Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. First up, Florida is investigating a second suspected case of Zika transmitted by mosquitoes.
If confirmed, these would be the first such cases in the U.S. This comes as the CDC is raising the possibility that Zika can be spread from one adult to another without sexual contact. Here's John with more.
Last month, an elderly man died in Utah after contracting Zika outside the United States. A son who helped care for him became infected despite having no recent travel to an area with active Zika and no sexual contact with an infected person. Utah officials say the Aedes mosquitoes that spread the virus have not yet been found in Utah. So far, Zika has been shown to be spread by mosquitoes, sexual contact, and from mother to fetus, where it can cause devastating birth defects. Dr. Denise Jamieson of the CDC says health officials are concerned with the possibility that infection was spread by close contact with body fluids.
It's very important that people who are caring for critically ill patients avoid body fluids and carefully wash their hands after contact with critically ill patients.
John, what are you hearing from health officials now?
Every single health official I've spoken to is extremely concerned, especially because more than 5 months have gone by since Congress was asked by President Obama for $1.9 billion in funding to help fight this and get ahead of it, and no new funding has been allocated. And they're just wondering, saying, really, are we going to squander this opportunity to get ahead of it? And I will tell you specifically, I spoke to Dr. Umair Shah, who's the head of public health for Harris County. That's where Houston is. And he said it's not just a matter of buying traps, for example, for mosquitoes. They've ordered those. But when they come, they need money to hire the personnel to pick up the traps, to examine the mosquitoes. They need the lab stuff. They also need the ability to repair, for example, broken screens in neighborhoods that have that, because that's a setup for having mosquitoes spread. And a simple thing like mosquito repellent, he said they don't have enough funding for that.
Yeah, we're definitely already behind the 8 ball on this, and every week we're learning something new. I don't really understand what the holdup is, but we certainly need the funding fast.
All right, moving on this morning, the nation's largest pediatricians group is urging doctors to talk to young patients about sex. I feel like every parent supports this plan.
Yes, so this new guidelines and report is coming out and based on new research since the last report was published several years ago. And really what it's saying is that pediatricians should be, and we need to be, educating our kids to give them a positive and safe message about sexual health, to prevent unwanted pregnancies in adolescents, to prevent HIV and sexually transmitted diseases. Currently, only 1 in 3 adolescents report that they've had some sort of sexual health education by a pediatrician. And if they do get education, it's for less than 40 seconds. But the pediatrician's office is really a safe place that they can provide accurate, up-to-date, personalized information, and not just about anatomy and physiology, how we used to think of sex ed, but really about what sexual education means now, which is gender identity, sexual orientation, body image, intimacy, affection. It's a much broader issue. And it really needs to be thought of as a developmental milestone, just like we think of for our babies. Did they sit up? Did they roll over? You need to reach that to have a normal, healthy sexual sense of self for the rest of your life.
In the report, John says teaching abstinence, just abstinence, isn't enough.
Right, and they're promoting abstinence, but also including comprehensive sex education. I think Tara really said it beautifully. The idea is there's also emotional health. It's not just anatomy, where is what, but all of the things around us. We think about all the sexual messages that are around us all the time. And these are often from people who are trying to sell us stuff. You have teachers, you have parents, and you have pediatricians. These are people who really you should be listening to in this setting.
I mean, it feels like parents also have to piggyback on whatever a child is hearing in that office. What are the things you tell patients, or parents for that matter, how they should talk to their kids about this stuff?
Well, first of all, it shouldn't be a one-time birds and bees conversation when a child reaches 13 or 14. It should be a series of natural, gradual conversations that start early and happen over the course of years. And that really builds a relationship with the parent of respect and trust. You should use teachable moments that happen in your life. You're watching television, you see someone dating, you talk to your child about that. You have a family friend who's pregnant, you talk about that. You need to speak in an age-appropriate manner. So when my 3.5-year-old asked me, Mommy, what is sex the other day, and my mouth almost went to the floor, she was referring to what she heard in school. Sex, meaning male and female. What is that?
Right.
And we need to listen more to our kids. Listen, not talk at them, not talk down to them, but listen. And finally, stop using all the don'ts. Don't get pregnant, don't do this, but really use it as a way to empower our kids. How do I handle a situation, mom or dad, when I feel pressured? What should I expect in a normal, healthy sexual relationship?
And it's different. When she says what's sex at her age, she's not asking the same question as somebody 10 years later. I asked the woman who wrote this report, I said, well, when do you kick the mother or father out? She said, at 12. So you talk to them, but then you say, out, I want to talk to the kid alone.
Right. It's a tough question to get from a 3-year-old. All right. Finally, new research finds that the novel on your summer reading list might do more than provide some diversion at the beach. A Toronto-based psychologist argues that reading narratives may encourage empathy. He writes that when readers explore the lives of characters on the page, they can develop sensitivity to other people's real-life emotions, motives, and feelings as well. Makes that summer reading sound way more productive.
If there ever was a time when the world needed to brush up on empathy,
yes,
it's now.
Absolutely.
Doctors Jon LaPook and Narula, thank you both.